think I think our group has probably completed this. So I'm going to go ahead and end the poll now so we can all kind of take a look. So about 33% of our audience here are entrepreneurs themselves, which is awesome. A couple looking to start a venture. Hopefully you'll hear something tonight that inspires you to take that next step. I'm sure our presenters are also willing to answer any questions you may have about this crazy journey. Got a marketer in there, designer, a few software developers, and some others. For those who did put others, if you want to, please feel free to type into the chat what you would have put for yourself if you had the option. But again, the reason why we like to run this poll is to just kind of see who's out there and to show that our community is pretty diverse, which is one of the hallmarks of the A2NewTech community. So thank you for indulging us in this poll. I'm going to stop it real quick. And so another kind of great way for you to engage with this community, particularly right now in these times that we're in, is our Slack group, which I'm going to share the link to in the chat. It is made in a2.com/Slack. You can go in there to announce things yourself, announce jobs, whatever it may be, particularly with the school year coming up. People like a friend of the community, Brian Hayden, has shared things like different internship programs through U of M. So if you aren't part of the Slack group, please do join it. There's a lot of good information in there. I think the most recent kind of conversation has really dealt around the loss of power and where you can work while you wait to get your power back on. For those who are new to this, just real quickly, how this is going to work. We have 3 great presentations tonight. They'll have 5 minutes to present their startup, 5 minutes of Q&A afterwards. For the Q&A, please do type your question into the chat. The presenters will be reading them and answering them. If they don't get to your question before the 5 minutes is up, don't worry. They'll go ahead and respond in the chat as the next presenter is sharing their startup. After that, we'll go into community announcements. So those can be things like if you want to announce other meetups that are going on, if you're trying to hire, whatever that may be, think about yours and use that time to share it. After that, we'll go into breakout rooms to network and chat. So we'll break out to about maybe 4 or 5 people in a room. So do hang out and just meet each other. And so before we get into our main event tonight, I want to do a quick thank you for our sponsors who keep the thing running, A2 Geeks, our own Roger Rails, and our co-organizers, the Entrepreneurship Clinic at U of M's Law School and Ann Arbor Spark. And talking about Ann Arbor Spark, we're actually going to do something slightly different today. Before we jump into our presentations, I'm going to actually hand things over to Ben Ernst. He's a program manager with Ann Arbor Spark to provide a quick overview of the My STEM Forward internship program, which particularly for your the entrepreneurs out there, that might be of great value for you. So with that said, Ben, I'm going to hand things over to you for the next few minutes.
Awesome. Thank you. And I really am only going to take, I'm going to take as minimal amount of time possible. So hopefully I've shared the screen there.
Yep.
I just kind of want to run through, like Heinz said, I think that there's a lot of folks here today who might get utility out of this program. So I just kind of want to introduce it a little bit if you're not familiar with it. And if you're not familiar with it, I don't blame you. We've only been running since about mid-May. So it's very new. It's very new to the whole ecosystem, and we're hoping that it gets some serious traction and can really help out a lot of companies in Michigan. So it's the MI STEM Forward program. It's been up since May. It's being run by it's like a combination of MEDC and Ann Arbor Spark, but it's available to companies across companies and interns throughout the entire state. So there's sort of 3 main goals to the program. First goal being to retain students in STEM fields in the state, because it's any kind of secret that we lose a significant percentage of those particularly computer science students to other states, particularly the coasts. The second one, which is hopefully the carrot that makes this program a little interesting to you all, is to help with financial support for these internships. The program provides a dollar-to-dollar match for interns, up to $6,000 for a full-time intern and $3,000 for a part-time intern. So it can be really helpful in that way. Another thing that's not on this slide, but is also really beneficial, particularly for small sort of startup companies, is the fact that we do all of the administrative tasks as far as hiring the intern, paying the intern on our side. So all we really need from the companies we work with is a quick email saying, this is the student that we've identified. This is when they start, and this is how much we're paying them. And then we do all of the background stuff, which can be really helpful. And that's particularly true, I think, for international students, because we take care of all of the visa stuff as well. So it can make it really streamlined. And the third one is purpose of the program is to develop partnerships with the MEDC, with the between colleges and universities and students and their local economic development organizations. That's really the first node of contact for our program. So some of the sort of the nitty gritty of what it looks like, and actually my little bar here is covering my, oh, there we go. So like I said, there's a dollar for dollar match up to the cap that I was talking about for the companies that employ the intern. And like I mentioned already, gosh, I already went over this, didn't I? $3,000, it would be the half that the companies, their half of the contribution for a full-time intern, and $1,500 for a part-time one. This is year round. We're looking to place interns always. We're hopeful that eventually we have half of our interns in the summer, and then we can spread the other half over the rest of the semesters. They're also really flexible from a timeline perspective. We have a lot of companies actually right now, because students can work remotely, who are just sort of extending internships for several months, and that's totally fine as long as we're under the cap. And also there's a push to try to spread this across the entire state. So we're hopeful that each portion of the state doesn't get over 25% of the grand total. Okay. So I just leave this slide kind of blank, just kind of a status update of where we're at. So like I said, we started in mid-May. The goal is to have 450 interns placed per year. We're at, I think, 125, I think, at the moment in the last 2.5 months. So we're really making good progress. We have a student database of about 1,000 students who've signed up and who have submitted resumes and are interested. And it's searchable, and it's really easily digestible by companies who are looking for talent. And we placed 125 or so of those 1,000. We have about, I think it's 140 companies who signed up. We have about 190 specific job descriptions. So we're making headway. And my big ask, because I know I'm not a normal presenter here, but I know everyone gets to end with an ask, so that's what I get to do too. I just decided. Is that if you have need of an intern, or you know of a company, you work with a vendor who might need an intern, and it's a STEM related internship, please just kind of point them our way, because it can be really lucrative as far as helping to pay for that intern. And my background is higher ed, so my whole goal in this is to place as many students in really impactful internships as possible. So I hope that was short. I have no idea because I blacked out. But that's my contact info on this last page here. Thank you. I appreciate the opportunity to speak. If you have questions, I'll hang around if you want to type into the chat. Otherwise, if you email either of those email addresses on this page right now, or if you go to our main webpage, which is just Ann Arbor Spark, under jobs, the MI STEM forward, and you can find all kinds of things there, including contact info. So unless there's any questions, pressing questions right now, I will turn back over. And again, I thank you so much, Hein, and everyone, for the opportunity. Appreciate it.
Yeah, absolutely. Thank you, Ben, for sharing STEM forward with the group. If you have a question for Ben, feel free to type it into the chat. You do have his email in there as well. And as he said, he'll be hanging out. But if you know of anyone, any company that could be using some interns and support this program, or who you yourself can support it, please do. It'd be really great. And with that, we'll get back into our regular scheduled programming. So tonight we have Caregivers Insight with Chris Jue, IndividuALLytics with Kevin, sorry, I want to say Kevin Nash because of the WWF wrestler, but it's actually Dennis Nash, and Innsightful with Farzad Ehsani. So with that, I'm going to hand things over to Chris to share Caregivers Insight with everybody. So with that, Chris, I'm going to spotlight you.
Here we go.
All yours.
See that?
Yep.
Great. Well, good evening, or depending where you are, like Courtney and Farzad, good afternoon. Thank you for your time, everyone. And I'm Christophe Jue, co-founder of Caregivers Insight. And I'd like to start off by asking a question first. If you have a loved one who lives some distance away, how are they doing? This is a meaningful and difficult question, especially when they're older or living with a medical condition. We are focused on family caregivers, providers of care, and the loved ones that they support. Our mobile app simply and thoroughly answers that question. Caregivers Insight was inspired by my father. And then I realized this was a widespread problem that continues to grow. He was diagnosed with Alzheimer's. And I live in Midland and he lived in Fresno. So we had to FaceTime and use Google Hangouts just to see how he was doing. His caregivers used these forms to document his health condition, including noteworthy events during their shift. And these forms were kept in binders that collected dust on our kitchen counter that weren't very useful to me 2,400 miles away, nor did it answer that question. How's he doing? His fourth hospitalization in 2 years due to dehydration was preventable if caregivers could see that he was becoming dehydrated. That was both heartbreaking and a breaking point for our family. This had to stop, and so I created Caregivers Insight. And on at least 3 different occasions, using this app, everyone caring for him knew that he was becoming dehydrated before noon and took action so that he didn't have to go to the hospital. Now, the most commonly used tools to document your loved one's health condition is these paper forms that you see. Practically every single caregiver, every caregiving agency, and assisted living facility uses some version of these forms, but there are gaps and limitations to them all. So much happens over a shift for a caregiver that they can't remember and don't know what to document. And as a result, the documented information is inconsistent and isn't relevant to ongoing care to the extent that caregivers don't even look at it. And with this manual process, it is poorly maintained and rarely referenced by caregivers. And when they do have to do this, caregivers feel that it's nothing more than busy work. And you can't really share these paper forms remotely, and caregivers can't see troublesome trends with these forms. And if you can't see trends, you're receiving blind and reactive care. Our mobile app solves many issues caregivers and families face with menu-driven questions and answers based on one's diagnosis, and includes mental, physical care questions with pre-selected answers based on their diagnosis. And these answers are then transformed into graphs and and trend lines that you can compare to normal baselines and important levels. These insights can be then shared with anyone involved in the caregiving spectrum, and that would include family, therapists, doctors, nurses. And with so much information that is available to so many, that is so easy understandable, it truly leapfrogs the paper forms. And it is a very simple subscription model in which we operate. Now, the caregiving market is huge. There's over 40 million caregivers who care for those 50 years and older. And it's the growth of caregivers are going to continue to grow and mirrors that of the aging baby boom generation. And as they choose to age in place, the demand for caregivers will continue to rise. Now, to reach these over 40 million caregivers, we have a multi-pronged approach to going to the market. And our initial strategy will be through caregiving support and resource organizations. And they're very important because they support the caregivers themselves. One example is Valley Caregivers Resource Center, and they directly support 14,000 caregivers in a market of 180,000. And there are numerous of these sorts of large organizations that reach out to them. And that's one of our major prongs. And these early relationships we have will help us move us forward. Where we are now, we are in the process of launching our public-private beta. We are fundraising right now that will help build out our development and sales team. And then we'll have a public launch at the beginning of 2022. I'm one of 3 co-founders. We have a caregiver who's our head of product, who is a caregiver for 6 years. We have a CTO who's been helped develop our mobile app today. And we also have a great team of advisors, all focused on caregiving, a palliative care, a doctor, as well as a gerontologist and a medical technology entrepreneur who's helping us along the way. So with that, thank you very much. If you have any questions, comments, I'm open, but our real goal is to start raising capital and finding some good talent. Thank you.
Thanks, Chris, for sharing Caregivers Insight with everybody. As I mentioned to you, like I have my own personal experience of being a caregiver for my father, so I think this would have been very valuable for us. But looks like you already have a couple questions here. But my one I want to ask you real quickly is, what is your ask for our group here?
You know, we've got there's 3. We're looking for relationships with caregiving organizations, support organizations, access to talent. You know, we are a mobile app, although we are not. That is not our core. Our core is really helping and supporting caregivers. So we're looking to build out our technology team, and then any relationships to potential investors would always be invited and accepted.
Awesome. And with that, looks like you have 3 questions in here already, so I'll let you answer those.
Okay. So first one, can the app be integrated with devices like GrandPad, an interactive iPad with social media and admin by the family? You know, we've chosen to stay outside of integrating with devices. Our next version, or as we move along, will be really to integrate with wearables. So there's less input or that sort of exchange of information. So at this point, not yet, but I'm sure that will be something that we will also consider down the road. How does this app differentiate from other caregiving? Okay, great, good question. So eCare20, so there are mobile apps out there, but they have a totally different business model. eCare21 and a lot of them are really focused on medication and medication ordering, refilling, because that's their biggest form of reimbursement, as well as through Medicare. Our activity and our focus is really on the caregivers. We have over 60 insight questions that you can customize and answer and see the trends. So that's a major differentiator from the standpoint of we collect and are able to show a lot more information that is truly shareable with everyone else. And there are 20 apps in this space. Yep, there are. I mean, a lot of them are remote patient monitoring, and I think that's a very important distinction. But very few are focused on the caregiver market, and it's just being thrown out there. I think eCare21, there's others, they're really focused on Medicare reimbursement for medication. Great for families, but what about the caregivers? Haven't you doubled their data input load? Yes, we've increased their data input load, but the interface of which we've created is truly menu driven, and it's usually it can be used on your mobile app, and it doesn't have to be completely filled out at one time. You can tick off various different questions and answers as you go through it. So we've looked at it, we've done some time tests. It might take someone up to, your first time you do it might be up to 10 minutes to try it if you use 60 questions, but usually people are getting down to the 3 to 5 minute time frame. So the workflow is actually streamlined, and the workload is a lot less intensive versus writing and texting. Most of the apps out there focus on, you got to type in a bunch of words and explanation and summaries. Ours is fully menu driven. Yeah. There's a lot of apps that people will look at. And again, it's focused on remote patient monitoring is the big push to improve on the telehealth, and it's all focused on reimbursement. What's our revenue model? Yes, this is a subscription model. It ranges between $5.99 and $9.99. So we've really tried to lower the barrier of adoption and use. So yeah, that's our subscription. It's on a monthly basis.
We have about another minute or so for Chris here. Like, any other questions?
Comments? Bad idea? Good idea? Terrible idea?
Caregivers are overburdened. It's a great idea.
So Shane asked, how do you anticipate getting caregivers on the platform? It's really through the caregiver, it's multi-pronged. It's caregiver support organizations that actually interact and provide programs and support for them. One, for example, is Valley Caregivers Resource. The other one would be PACE. It's a public-private national program where they actually try to help people live and age at home. So that's another adopter that's very interested in, because it's going to help their workflow and their ability to track and see how their clients are doing. And then, believe it or not, there are unions around the US for caregivers specifically. So this could be another not value proposition, but a value tool that they could use to make their lives and jobs and professions a little easier. Okay.
Awesome.
Great.
Thanks, Chris, so much for the presentation tonight. That was really great. And we will move on to Dennis, who's going to share IndividuALLytics with everybody. Sorry, IndividuALLytics with everybody. I'm going to spotlight Dennis.
That's
So
great,
whenever you're
Jared.
ready, it's all yours.
Yeah. Well, screen sharing just fine then?
Yep, looks good.
Great. Well, everybody, it's a pleasure to meet. IndividuALLytics is focused on helping physicians treat patients with challenging multiple chronic conditions, getting them better faster, while physicians earn 2 times more in less time. This represents an incremental 2.4 million per year revenue for each physician. And I'm Dennis Nash, the CEO and co-founder of IndividuALLytics. We are an international patent pending software as a service decision support solution. We're enabling the optimization of each patient's health outcomes, who take on average about 50 prescriptions a year. And it's to help them get better health outcomes and better blend the right medications and lifestyle changes and actually support them in successfully implementing them. An IndividuALLytics comprehensive solution was designed by our clinician team for clinicians, so it's very doctor-centric. And the large systemic problem stems from 40% of adults have 2 or more chronic conditions, for 58 million in the US, representing $2.7 trillion a year in spending, and it's expected to just double in the next 10 years. This is exacerbated by the fact that there's a shortage of medical practitioners. Polypharmacy, the mixing of medications, got very low effectiveness and very low adherence. So in other words, people don't listen to their doctors real well here. And it's complicated by nearly all these patients have either mental health, social health, or life health challenges on top of that, which doctors aren't set up to address. And then the physicians actually are running something called a manual N of one patient at a time experiments, but they measure that where they try certain medications or lifestyle changes one at a time across multiple time phases to determine what works well for a patient. And today's manual health diary has limited data, and it's burdensome on the patient and the doctor, and it's extremely low precision. IndividuALLytics sits right in the middle of the doctors and patients with an improved family caregiver communication tool and an IAQ Plus small data analytics that also provides multidisciplinary care team support so that the patients can understand, own, and implement their personalized complex care plan with a lot more precision. And IAQ Plus exposes small interventions to evaluate conditions quickly and accurately to help achieve better outcomes and sustain those for many years. The solution covers a system that's patented, collecting time series daily data in evaluation phases to calculate N of 1 scores. These are called IAQ plus for IndividuALlytics quotients, and we display these for the doctor and the patient in simple to understand dashboards. The simple plus, and double minus provides power for knowing whether the positive or negative effect is statistically related to the last 2-week change that we made in your intervention. And by making intervention changes really small, we make it easy for the patients to get better. And if something's not working, we make it easy to find something that will for them. The doctor digital rounding IAQ plus dashboard demonstrates how quickly it is to evaluate Raymond. He needs additional help with blood sugar levels, systolic blood pressure, and depression, and that adherence has been great. And the doctor will recommend additional medication and lifestyle changes. And a care captain from our team will orchestrate the best multidisciplinary care and personalization treatments to update just for Raymond and his family caregivers, and this integrate appropriate social mental health support for optimized care. The care captain coordinates updates to the medical systems with limited doctor actionable alerts. They're very high accuracy, very low false positive, false negative alerts, which is currently happening a lot with the competitors. And only IndividuALlytics can organize $200 to $400 per patient per month level of care that health insurers are making available today that allows this type of care management to deliver great outcomes for the patients and support the doctors and our multidisciplinary care team. One doctor group, Prospect, has over 700,000 patients with multiple chronic conditions, or about $48 million per year variable profit. We built a strong set of relationships to grow quickly with our process outcome improvements, and we are able to show 5 times better outcomes than current standard of care. Authority Health down in Detroit is a community health program that just launched 20 patients with us, and we're on track to get to 10,000 patients in the next year. IndividuALlytics has a sustainable competitive advantage with higher population effectiveness, and we help doctors and payers earn more. Imagine your mom with 3 chronic conditions when current population health only standard of care with emerging telehealth solutions, column 2, is compared to the leading high growth validated single conditions, population health like Livongo and others, versus IndividuALlytics precision and personalization that works with her doctors and is designed from the bottom up for multiple chronic conditions. Which would you want for your mom? We have a great team, Dr. Steve.
Hey, Dennis, I'm going to have to cut you off here. Your 5 minutes are up.
No problem.
But with that, thank you so much for taking the time to share IndividuALlytics with everybody. Looks like you already have some questions in here. So same question I had for you, for Chris, I'll have for you. Like, what is your ask for the group today?
So our main immediate need is we're looking for a web developer to do some dashboard rapid prototyping in WordPress, MemberPress, and some general web programming. So if anybody knows anybody who's looking for about a 2 to 3 month project, we got a good team and a great opportunity to work with doctors and patients. And then like other startups, we're still looking for more customers, physicians, as well as investors.
Great. And yeah, looks like you have some questions starting with Mark in there. So.
We have pitched this to investors. We're about a third of our way through our seed round.
Oh, actually, Mark actually asked a question a little bit earlier, asking, did you say making physicians 2.4x more money? Is this the problem?
Did you say making? So the problem that physicians have is they are going full bore trying to keep up with their current workload, and consequently, it makes it really hard to earn more money. The EHR systems or the big medical systems have turned them into data entry clerks. We take their most complicated patients. The average doctor has about 1,000 multiple chronic condition patients, and they take the majority of the time. So we free that up and turn that into incremental revenue at a much higher pay rate than they're making today. So it's not necessarily their biggest problem as they wake up this morning, but once they hear about this, they get very excited. Does this work with COVID? Is that the next one?
Yes.
So we started this project before COVID, actually, and it took us about a month to add COVID management because COVID's both an acute and a chronic disease. And so we have actually chronic care management around COVID-19, all integrated with things like diabetes, depression, hypertension, about a dozen different high comorbidities. And the tool will be used for non-chronic but major. So the connection relative to acute care and surgeries is the notion that nearly half or more of the patients coming out of a hospital also have chronic conditions. And that makes it very complicated for the acute care professionals to do their job well. And it also makes it hard to transition them to home and make sure they don't come back again, what they call readmission. So we augment the acute care world, which is the majority of the healthcare system prior to COVID anyway. Quite complicated pitch. Who would you present this to? Well, we've presented it to investors and to doctors and done pretty well with it. I missed your 60 and 30 seconds, sorry.
No worries.
Have you pitched this to investors? We have, and Birmingham Angels and several other investors have invested a little over 300,000, and we're on track to raise 900,000 in the next, or the remaining part of 900,000 in a seed round. And then we have a $9 million Series A planned for next year. We basically get to 18 million in sales around 10,000 patients, which is sometime early to mid next year, and we're profitable at that point. And yeah, so we did a international patent filing, and the way that process works is we are now in what is called the national phase in the US, Australia, China, the European Union, and I know I'm missing one more state or country, but basically it's all the high digital health markets. And it's a pretty exciting opportunity because every major country has very high multiple chronic condition patient numbers as well as very high cost. This is basically one of those things that's going to bankrupt all these big countries if they don't get it under control, and we've got a major advantage. Right now we're sitting at close to 40 patients paying through insurance. Medicaid, Medicare, and most of the major insurers pay for this, so it's already covered. And the reason they're paying for it, it has been proven to reduce emergency room visits, hospitalization, and in our model, we also reduce medication and specialization costs.
Dennis, you have about a minute. So it looks like you've answered a few of Hassan's questions. So it looks like Shang here has a question for you. Just want to give you some a chance to answer somebody else's question.
Yeah, so we are actually very complementary to the larger medical system companies like Epic and Cerner. They are mainly tracking billing and doing acute care management. They're actually very late to the game in doing chronic care management. And their current approach is like all the other competitors. They're adding what's called remote patient monitoring with population health. And there's 5 years of evidence to say that doesn't actually help patients get better. And then they're also implementing something called chronic care management, which is about 20 minutes of nurse care trying to help patients adhere to medications at home. And there's also evidence that that's not making patients actually better. So we've taken the billing codes, added N of 1 and a much more sophisticated clinically meaningful care kit that doctors have helped us design. And we're going to be about 5 or 10 times better than any of them. And with our patent and our knowledge base, we expect one of them to buy us at some point.
Great. And then I think with that, I think that's your 5 minute for Q&A, but there are still a few questions from Hassan in there. If you want to, feel free to respond to them in the chat as our final presentation is going on tonight. But I want to thank you again for your presentation. And if you just don't mind Just real quickly again, mentioning what your ask is for our group tonight.
Yeah, no problem. So here's my contact information. And if you do know somebody that's interested, we need real quick, somebody with UI, UX, rapid prototyping, WordPress, MemberPress, and programming skills. And thank you for the time. And really appreciate you all getting together.
All right. Thank you so much for your time tonight, Dennis. And with that, we're going to wrap things up with Farzad, who's going to be sharing Innsightful with us. So whenever you're ready, feel free to present. I'm going to add you as a spotlight, and it's all yours.
Mute myself. There we go. Can everybody see this?
Yep.
Okay, great. Thank you again for the invite. We are excited to present. I'm Farzad Ehsani. I'm the CEO and co-founder. As you all know, mental health is a pandemic. 51 million adults have mental health issues. This is all pre-pandemic, and only less than half receive treatment. It's costly and siloed, and we need a solution that's objective, integrated, and comprehensive. Me and my co-founder, this is our third company together. We basically sold 2 companies in the past. Last one was in 2016. We started this company because we're both very passionate about mental health, and we've had personal experiences with it. We're specifically, our initial target market are college students. The spending on college students is pretty high. Universities are hurt. There's dropout. 23% of the students are on psychiatric medications, and anxiety and depression have been increasing drastically since 2015. It's just almost doubling both anxiety and depression. And again, pandemic is just making everything worse. The main problem is pairing people with effective treatment is very difficult because there is no thermometer that can measure whether the person is getting better or not. With a temperature, you can tell, that the aspirin reduced the fever or it didn't. Should they go emergency or not? And right now, we don't have the equivalent mechanism. We basically, depending on what health plan you have, we make a recommendation. The person goes to receive that kind of a treatment. It may or may not work. It takes days, weeks, months sometimes to figure out if a particular treatment is effective or not. What we're doing is we're using micro-targeting to provide personalized therapy. We have an AI engine. We have 3 patents on this. We're writing a 4th patent right now. We're measuring symptoms to detect anxiety. Then we have and this is a wristband that we're using. I have one here. We're measuring symptoms, detect the anxiety. Then we have a dialogue with the person. We provide suggestions and therapy. We remeasure the symptoms for effectiveness, and then we do digital phenotyping of symptoms and therapeutics. We just started an NSF grant with Stanford University to basically collect data and fine-tune our models. Our market size beachhead is right now fairly small, but it's actually becoming larger. Universities are hurting, but they're not using a lot of software in this space. Our current product that we're testing is fulfilling emotional needs, providing a relief, providing psychoeducation, and a lot of tailored content. We have 53,000 followers on Instagram that we're basically using to test and develop our content with. And we have tested about 150 users. The landscape here, there's lots and lots of companies in this space. There's a whole bunch of group of people like Talkspace and Mindstrong that are basically very expensive, and they're providing a therapist. And there's another group that are cheap and highly, they're not personalized, but they're fairly inexpensive. And there's a bunch that are using devices. We are basically trying to provide high quality personalization that's always available. Our commercialization pathway right now is we're working with a number of universities. We're going live with University of Northern Colorado in about 3 weeks. And then we have a small Salesforce team to start selling in Colorado specifically. And then other applications, we're looking at our police departments and military and nursing. We have a number of very excellent company advisors. They're basically therapists and doctors. As I said, we filed for 3 patents. We're filing a 4th one. And why are we doing this? Well, the wearables are just coming along. There's a slew of wearables out there, and so we don't even have to develop our own. We're partnering with the best of them. There is mental health is becoming a much bigger issue in the world, and so there's lots of solutions. That's what we're trying to solve. And basically, we want to avoid crisis before going to the ER, reduce costs, and address all the stages of a person's mental health. And finally, we're looking for investors, partners, and customers.
Great. Farzad, thank you so much for sharing Innsightful with us. It's really kind of great, and it's always great to kind of see those out there supporting those in the mental health space. Looks like you already have a couple questions here from Hassan, so I'll let you go ahead and take those.
Let's see. Yeah, actually, Hassan, you're right. They are using their own wearables, wristbands. Right now, we have a specialized one because we have to build these complex models. Down the line, we basically see us integrated into Apple and a number of other wristbands. But initially, we're just starting with one. We're talking to all the other ones. Contact info I can send.
I can take care of that.
Yeah, that's my contact info. Anything else?
I think people are probably taking their getting a moment to write their questions, but you had mentioned like real quickly getting into this space, like into the mental health space, like was inspired by something like, yeah, obviously you don't need to divulge like the sensitive healthcare aspect of it, but what kind of inspired you to get into the mental health space?
Yeah, I mean, I basically had personal challenges with mental health, and that really, and then I saw how broken the system is in terms of getting help, getting support, getting better. And I was quite lucky. I had access to a number of people, and I just realized the journey is really hard, and price point and lack of availability and just lack of knowledge is really, making it very difficult for people to receive it. But the other aspect is just the cost, that if you have mental health issues, everything else becomes more expensive. So if you have like chronic disease conditions, the cost of treating those becomes double if you have even smallest amount of mental health issues, whereas treating mental health is only a few $100s. And so for a few $100s, you could save thousands of dollars. The ROI is there. There's a lot of solutions out there. I just haven't seen anything integrated. Okay, anything else? SMEs and AI, can you predict AI without data? If there's no paid users, how does the AI work? We are actually paying users as part of this NSF study. And our aim is to collect data from the users. We need a few days of data. We'll also have a laboratory version of the test where we can put them in a lab and stress them out in a sense, and then get our data that way. But that's actually one of the lacks in the market right now, that there is very little data available in this space. So that's also an advantage. I'm sure the building is healthcare applications, HIPAA. What city are you based in? I'm personally, we have an office in Ann Arbor. I'm personally right now in the San Francisco area. Can you please tell us more about my parents? No, that's not about me.
Patients.
Oh, patents.
Patents, sorry. Yeah, I saw the parents part, I was like,
I could tell you about my parents, but not that much. We've basically filed 3 of them. They're in AI space. Me and my co-founder have about 30 patents between us. In general, we know what we're doing. This is 3 more. I mean, in 10 seconds or less, it's hard for me to say. They're basically algorithmic ways to determine if the person has anxiety and then what to do about it.
think maybe folks are still writing questions in, but I think you mentioned this is your, oh, never mind. Hassan there has a question for you.
Oh, I see. How many users? You're asking some very specific questions. In general, you need, I mean, I'm giving you generic numbers. We're still trying to figure this out ourselves. You need at least 30, 40 to get started. And again, depends on how much data we're collecting. We're collecting a lot of data from each person. But to build a very generic model for everybody, we need several hundred. Right, and then we're actually trying to do all the right balancing and everything.
I guess with like about 40 seconds left, unless another question pops in. I was gonna ask.
Probably. I mean, thousands is better. I mean, there are ways to, if you can find the right users, you may be able to do hundreds, but thousands is a lot safer. Tens of thousands is even better.
Definitely. Yeah, I guess the question I had for you was like, I think you mentioned this is your third venture, like, so I'm curious to kind of ask, like, what kind of keeps you going in this kind of entrepreneurial startup world?
It's a lot of fun. I really enjoy it. I'm learning a lot. I learn a tremendous amount, and I just can't imagine not doing this.
Thank you for taking the time to answer that. Real quickly again, like, do you mind just touching on like your ask for the community before we wrap up?
Sure. We're looking basically for university partners or other healthcare partners who are interested in doing trials. We are raising some money, so that's always interesting. And then just people who are interested in this space, and we can learn from them and vice versa.
Thank you, Farzad, for taking your time to share Innsightful with us tonight.
Thank you.
And with that, I'm going to just kind of start to wrap things up tonight. I want to thank everybody for taking the time to join us. We're going to move into the community announcements portion of our A2NewTech. So as I mentioned earlier, if you have a meetup or you're looking to hire, feel free to type it into the chat right now. As that's happening, I want to do a quick announcement that for our next A2NewTech, the one in September, on September 21st, is actually going to be our first live hybrid A2NewTech. So we've been doing this remotely on Zoom for over a year now. I'm sure you guys have done thousands upon thousands of Zoom meetings between now and since the beginning of all of this, and would love to get some live interaction with each other. So we're going to try a live experience in September. So as long as everything with Delta goes the right way and doesn't get too crazy here. But we are going to do it at Forum. If you had joined us a few months ago, Heidi from Forum had presented Forum to us. They are basically right down the street from the old Lucky's Market space down there on Stadium. It's a really cool space, especially for the tech and startup ecosystem. We're going to do it in their garage, which is quite big. We're going to do this very COVID safe. So we're going to open it up to about 100 people. I think that's about capacity for what we can take. So when I do open it up, I'm going to set a limit on there just to make sure. So if you want to show up and you're vaccinated, you can come and join us. We'll do this in person. And for those who are not vaccinated and will feel more comfortable doing this remotely, we're still going to do this through remote. We're going to present this through Zoom, and you'll still be able to participate. But did want to give this a shot and give this a try. So the September 21st meetup will be live hybrid. And with that, let's see if there's any other kind of like community announcements that are going to pop up here. I can keep stalling for time as people are writing in their announcements. But yeah, we're still. Oh, looks like Shane's asking a question. Shane, if you want to just type it into the chat, feel free to just type into the chat. No, I'll go ahead and just like say it out loud. Okay, looks like Greg Walters is saying Ann Arbor IT in the D is on September 7th at Zingerman's Deli at 5 p.m. Just being able to hang out at Zingerman's Deli and grabbing a sandwich there is good enough reason to go. It's not to hang out with the Ann Arbor IT in the D. Shane at New Era ADR is looking to hire a junior developer as a company. Looks like Shelby from New Era ADR can provide more details. But there we go. Shelby's entered in her information there. New Era ADR is a friend of the community here. So if you either know somebody looking for a software engineering job or yourself are looking, definitely check them out. Thank you, Shane, for sharing. Aksha is saying that at Wayfair, a travel app, they're looking for a UI UX designer. That's a great name for a travel app. Couple more minutes to further announcements. I'm going to also add these to the meetup group. So it's there into the events. So there's some, maintain this for some length of time. All right. But with that, I want to again thank our presenters and Ben, because you're technically a presenter tonight, for taking your time to share your startup and the STEM forward with the community here. Our next meetup is on September 21st. As I mentioned, it's going to be our first live/virtual hybrid event. If you are fully vaccinated and would love to come out and meet everybody in person, we would love to have you. If you don't feel comfortable and aren't vaccinated, don't worry. We're going to keeping the Zoom going on for you to be able to participate that way. It'll be at Forum. It's a really great space for, particularly in the Ann Arbor startup community, for you to check out. So we'd love to have you there. And oh, looks like Dennis, you have a quick thing for those who are interested in digital health. You can check out 20 Phantoms at /HealthSparks/accelerator. Thanks for sharing that, Dennis. And I think that's kind of where we were connected with you guys from Diane Bowie. So she's not here today. I think she's in the Netherlands, but I want to thank her for connecting you three with us to present tonight. And with that, I'm going to conclude A2NewTech tonight. I'm going to start the breakout rooms and have everybody have a chance to connect with each other. And I'm going to, all right. So with that, I'm going to open the rooms right now. So thanks everybody again for another A2NewTech.